Hello, I'm Salley Gibney. Welcome to Let's Talk. ALS is a disease that's been around for many years. Many of us don't know anything about it. I personally didn't know anything about it until my brother-in-law Alan was diagnosed last October. Since that time, sadly, our family has had a crash course in ALS. Our show today is divided into two parts. First, we're going to talk about ALS, the disease, and then we're going to talk about living with the disease. So, thank you for joining us. In this segment of the show, I'm going to talk about the disease, ALS. My first guest is Dr. Roop Tandon. Hello, thank you for joining us.
Thank you.
Tell us a little bit about yourself.
So I work at the University of Vermont and at Fletcher Island Healthcare, and I've been there for 31 years.
Wow.
Yeah, I moved from Ann Arbor, Michigan, and I'm a neuromuscular specialist and neurologist, so which means that I have trained in neurology and I've trained in nerve and muscle and motor neuron diseases. ALS is one of them.
Wow.
And I teach, I see patients, I do research, I mentor junior people, residents, faculty, fellows who want to train in that specialty.
So you do it all.
So I try to do it all.
Yes.
Yeah.
That's wonderful. Thank you. And also with us is Lisa Anderson. Lisa?
Hi, Sally. I am the Vermont Care Services Coordinator for the ALS Association Northern New England chapter, and I work with families who are affected by ALS. I am a native Vermonter.
You are? Oh my goodness.
And
not too many of those around.
Right. I'm actually a sixth generation Vermonter.
Wow.
And I have two little children.
Wow. How old are they?
They are, let's see, 2 yesterday.
Wow.
And 4 this Sunday.
No. Oh, birthdays very close together. And Colonel Al Faxon.
Yep, I am the Deputy Administrator and the Chief Operations Officer of the Vermont Veterans Home. I'm a 30-year Marine Corps officer.
Wow.
Also taught and coached at Burton here.
Did you?
Locally, I did for a few years.
Wow.
I have 5 children. Out of those 5 children, I have 1 Marine Sergeant Machine Gunner and an Army Specialist MP. Both of those are veterans of Iraq, Afghanistan, and Yemen.
Wow.
And my wife Nancy works at Southern Vermont College.
Wow. Military family, huh?
It seems to be.
Yeah, that's great. Now, Dr. Tandon, will you tell us about ALS, the disease?
Yes, so ALS, or as the other name for it is amyotrophic lateral sclerosis, so that's the abbreviated form of ALS, also called motor neuron disease in other parts of the world. Here in the US, we call it ALS predominantly, also Lou Gehrig's disease.
Right, I think most people know it by that.
That's right,
Yeah.
that's right. So as the name suggests, it's a disease of the motor neurons, the motor system, which is affected in the brain and the spinal cord. And then secondarily, the nerves going to the muscles degenerate. And since the nerves nourish the muscles degenerate as a result of that.
Oh, I see.
The disease was first described in about the 1850s or 1860s.
Wow.
So it's really a very
been around
old
a long
disease.
time.
Yes, yeah. And a lot of progress has been made in the last, few years or decades. But in the last 20 years, we have learned a lot about the disease. So we know that there is a form that is not inherited. It's called non-familial or sporadic ALS. There's a form that is inherited. It's familial ALS.
I see.
And we now have about maybe at least 10 genes that are responsible for the familial type of the disease.
Wow.
And they are being identified every year, new genes that produce the disease. There's also a type that was seen at a much higher frequency in the Western Pacific, islands of Guam and some other islands there.
Really?
And where it was associated with Parkinson's disease and dementia. And that was referred to as ALS-PD, or ALS Parkinson's dementia.
I see.
And the incidence of that type is slowly going down, but we still have sporadic ALS and familial ALS.
I see. Now, how does this start? I mean, what are the symptoms? How do patients come to you?
Yeah. So the disease generally begins at its peak in the maybe 6th decade of life. And there was a World Literature Review recently. The mean age at which it began was about 58 years, 57, 58 years. In about a quarter of people, it begins with involvement of muscles of the tongue and the throat and the voice box, the larynx. So these people will have difficulty with chewing, with swallowing, and with talking. In the other 3/4, it begins with involvement of the limbs. So in half of those, the hands and arms are affected first. In the other half, the foot or the leg or the thigh muscles are affected.
Now, does it start with maybe just a weakness or a pain, or what are the symptoms of it?
So pain is not a prominent feature of the disease, but it is typically, patients may complain of muscle twitching or cramping, and then they rapidly develop weakness with atrophy of the muscles, so loss of muscles. In patients who have onset in the throat and what's called the bulbar region of the brain, those patients may have difficulty with talking, so slurred speech, and they may be mistaken for imbibing a lot of alcohol because of that. A lot of patients tell me that. Or they will have difficulty with chewing or swallowing and choking episodes because of difficulty in swallowing.
Now, is there a difference in the progression if it starts in one area or the other? I mean, what happens with
that's
that?
That's a very interesting question you asked, Sally, because we know the natural history of the disease. So we know that when it begins in the bulbar region, which is the throat and the tongue muscles, then it involves the arms, the next, and subsequently the legs. So there's a very organized way the disease progresses. And people in whom the disease begins in the bulbar region, they have shorter lifespans. The disease progresses more rapidly, obviously because they are more prone to getting choking, aspiration, pneumonia, etc. So they have more problems with the disease. In those in whom the disease begins in the arm, say on one side, or the hand, it next spreads to the opposite arm or hand, and then it spreads to the throat muscles, and then the leg muscles. So it's a very orderly progression. In those in whom the disease begins in the legs, it next spreads to, say if it begins in one leg, it spreads to the same side arm, and then the opposite leg, and then ultimately the bulbar muscles and throat muscles. So again, a very recognizable way that the disease progresses. In terms of timeline, people who have bulbar onset disease, their disease appears to progress, as I mentioned, a little bit more rapidly, whereas in those in whom it begins in the hands or in the feet or arms and legs, it progresses just slightly less rapidly than that in the bulbar distribution.
So people do they come to you, or I guess they go to their own doctor first and they have some of these symptoms, and then how is it diagnosed?
Yes, so depending on where it begins, the referral is sort of dependent on that. So for example, in some people where the disease begins with their throat muscles or their tongue muscles, they may actually be referred to an ear, nose, and throat doctor first by their family physician, thinking that they may have some problem there, until it's recognized that they have a disease that's more widespread than just in the throat muscles. In some people in whom it begins in the hand, they may be wrongly thought of having carpal tunnel syndrome. So they may be sent to an orthopedic doctor. And then it's realized that they have disease more widespread than just in the hands. And then they are sent to a neurologist. So depending on where the disease and the first symptoms begin, their referral may be appropriate. It's interesting that maybe until about 15 years ago, it took about a year to a year and a half to diagnose a person with the disease correctly, because they went from sometimes one doctor to the other, and with the diagnosis not yet established. But we now know, and I think this will depend on, again, awareness amongst the population as well. The more people are aware of, the more they will think about this disease.
That it's a possibility.
When they see their doctor.
Right.
So now it's that figure of 18 months, 12 to 18 months of waiting for a diagnosis is down to about 7 or 8 months or so.
But it doesn't, the impact of the diagnosis doesn't really have an impact on the course of the disease. I mean, once you're diagnosed, there really isn't, is there much that you can do to alter the disease or slow the disease?
Yes, you can. Oh, you can, absolutely. So, and that's what we do in our clinic that we have at the hospital. So there's one drug that's FDA approved for the disease. It's called Riluzole. And that drug slows down the course of the disease or progression of the disease. So initially it was a modest effect in the initial studies that came out with that drug. But now we know that if we get that drug into people and get them to take it earlier in the course of the disease, there is a more noticeable effect on slowing the course of the disease. So we can do that. We are working with other medications and experimental therapies that might be of benefit, and our group is involved in that.
And I want to talk with you about the research in a little bit, because I know our audience is very interested in that. Now, Lisa, could you share with us how do patients and families cope with this disease? Tell us about what you do with the ALS Association and the clinic, and how can you help?
Sure. I think it's pretty difficult to convey how devastating this disease is to a family and to a community. Our chapter covers the states of Vermont, New Hampshire, and Maine, and parts of the North Country in New York, because patients come over to Fletcher Allen to receive services. And our chapter provides care services, which include, we have a support group. We have two actually in the state of Vermont, one in Williston and one in Bennington. We provide resource referrals, consultation over the phone. We have a loan closet of durable medical equipment, which is wonderful, because many insurances don't cover things like that, and they're very expensive. We also provide education about ALS to families in the community, and we're basically just there to support the family.
And you do go out and visit with the families, don't you?
Yes, we do.
That's a huge piece, I think, having a person actually come and be there and tell them that they're not alone, that there's someone people who care about them and who can help them through this.
Yes.
Because it's huge, isn't it? It must be very devastating for a family.
Absolutely.
As I know, as we personally have felt as well. And so what kinds of things do you do for them that, as your support?
Well, if someone, for example, isn't signed up for, Medicaid or Medicare yet, because a diagnosis of ALS guarantees Social Security, disability income, supplemental income, I help them sign up for that, help them sign up for Medicare. If they meet income guidelines, they can receive Medicaid. That's one example of something I do.
People don't know that. They have no idea what is available for them, so they need someone to help them with that. That's huge.
Yeah, it is. It is. It's a very expensive disease, so things like that really help. And if someone is a veteran, I can also help them sign up for VA benefits, which are irreplaceable. The VA does so much for veterans diagnosed with ALS.
I was going to talk a little bit about that. And Elisa, talk about the clinic, the ALS clinic up at Fletcher Allen.
Sure. We have an ALS clinic that happens twice a month at Fletcher Allen. It's a multidisciplinary team of providers, including Dr. Tandon, and two other physicians. We have a nurse who's the coordinator of the clinic. We have respiratory therapy, occupational therapy, physical therapy, social work. We have a spiritual liaison, a palliative care nurse, and I hope I haven't, have I missed anyone?
Speech and language.
Speech and language, yes.
pathology.
Oh, and a nutritionist, which is very, very
which
important.
Is really, really important.
Yes.
Yeah. The nutrition for the patient with ALS is very important, isn't it?
Extremely important. In fact, we do a lot of research in nutrition and the nutritional aspects of ALS. And people with ALS who don't get adequate nutrition, it's very clear that their disease progresses much more rapidly than those who are adequately nourished. So one of our aims is to make sure that we identify malnutrition in people as early as possible in the course of the disease and then correct it appropriately.
Now, what is it about the disease that, I mean, because a person might be eating their usual food and they're becoming now malnutrition,
That's an excellent question. So one straightforward is that they have difficulty with, some of them have difficulty with chewing and swallowing and choking, and they may take a long time to eat. For example, if they sit with a family at a meal, everybody else is probably finished in 10 or 15 minutes and they still are eating 1 hour later.
Right.
So that's because of difficulty with chewing and swallowing or choking or difficulty in handling their saliva, which makes it more difficult to swallow. The second, so they're not getting enough nutrition that way. The second is just the mere physical weakness of their hands is difficult sometimes for them to feed themselves.
Right.
So that's the second cause. The third, which I think is equally important, is that people with ALS need more calories as they get the disease as compared to when they were healthy.
Now, why is that?
Now, that's a phenomenon that's not very well known, but we are trying to make sure that the people get to know this. It's because they have a condition called hypermetabolism. So their metabolism is working at a higher set point.
Oh, I see.
So they are consuming more calories. So it's partly because they're consuming more calories in general to carry out the same level of activity. It's also partly because they're weak, so they're using a lot more muscle.
Use a lot more muscle, right.
To produce the same level of activity.
Sure.
The third may be that some of them have difficulty breathing, so they are struggling to breathe.
Sure.
So that uses a lot of muscle.
Right.
And then they have a lot of muscle twitching and cramping, which also has caloric value.
So the body really needs a lot more.
It needs a lot more. And we have figured out that a patient with ALS maybe needs about 400 to 500 calories a day more than when they were healthy.
Wow.
So in a healthy male, the daily caloric need is about 2,500 calories.
Yeah.
So a patient with ALS may need anywhere up to 3,000 calories.
Wow.
And a woman would need about 2,000 calories, and a woman patient with ALS would need up to 2,500 calories a day. So we have to therefore be able to recognize that, be aware of that fact, be able to somehow measure it and determine that, and that's what we've been doing in our research, and then correct that caloric deficiency.
And educating the family to that, that's part of your job.
Yes.
Letting the family know all of these things, because how would you know? Now, Al, would you please tell us, there's a high incidence of veterans with ALS, aren't there?
Well, looking at the data, it seems clear that from the Gulf War, veterans have a 60% better chance of getting ALS.
Wow.
They don't really know why. It must have something to do with the environmental factors. I know there's been a lot of, different pointings trying to figure out exactly what it is. And who knows, I don't know if people remember, but the oil fields were lit on fire, so people were breathing in the petroleum products. So so really they haven't quite figured it out. And it's also a younger age group than the doctor mentioned. It's a little, it comes a couple decades earlier for a lot of those that participated. So I mean, it's interesting, and it seems to be a fact.
Yeah, and also Vietnam vets too, aren't they? There's an incidence of ALS with them. Now, the Veterans Home, the Vermont Veterans Home, tell us what you're doing there for veterans who are diagnosed with ALS.
Well, the Veterans Home, if you haven't been there, it's really an amazing place.
It's a home.
And that's what we do. I mean, of course, we're full service healthcare, and we have medical directors, and we have RNs, LPNs, LNAs, activity staff, dietitians. But what makes it different is when somebody comes in, it's not like going to a nursing home. It truly is a community, and I think it changes people.
Yes.
I could go on and use an example of your brother-in-law, but you know, people come in and all of a sudden they know more people than they ever met, and the staff becomes part of their lives. So even beyond the medical stuff that we do, I mean, that part, I think, just strengthens an individual's life, and they feel like they're not doing it alone.
Exactly, they're part of a family.
And they are.
You know, we personally have witnessed that and been a part of that and seen how the Veterans Home does embrace not just the patient, or the veteran, as you call them, but also the family, and that's incredible.
It's amazing. I mean, I try to tell people that if they come in, they'll see that it's a community. You know, they're not called wards, they're neighborhoods, and they truly are neighborhoods, and they have different personalities, and all those different things come into making it a special place.
And also, with you have had several patients with ALS there, and so your staff is really very accustomed to treating, taking care of these patients, which is amazing.
They are. You know, there's a lot of different things that go along with ALS, and we do have staff that is now comfortable with it and understand aspects of care regarding ALS. We have a ALS support group that meets every third Thursday of the month. Fourth, that's what I meant, was fourth, thank you. That's what we meant by the backup. And you know, it's a nice place, a nice environment to come and meet and learn information and to support each other.
And I know, I understand, Lisa, that it's not, you are incorporating other people into that support group as well. So if there are other people in the community could you address that?
Sure. We've invited folks diagnosed with MS as well to the group. Some symptoms are similar. Their experiences aren't the same, but similar, and I think it's been quite successful.
And they can identify with each other because they are going through many of the same things, which is very helpful. And I understand that there's an ALS walk.
We do. We have the ALS walk coming up, and you know, we have 84 acres of property.
Wow.
And we have a
Isn't that amazing?
Yeah.
And it's beautiful, especially this time of year as the leaves are changing, and we have a 0.5-mile walk on the campus, and I think we even have some music and all kinds of stuff going on.
And that's going to be an annual walk.
That's going to be an annual walk, and we're pretty excited about it. And you know, one of our goals is to use, we call it the Veterans Campus, and to use that land, you know, that's been bestowed upon us, you know, for the community to do things like this, for awareness of different things. So we're excited about it.
Which is really great, and it's really, the Vermont Veterans Home is a gift to the community, to the state of Vermont, actually.
Yeah.
And it's, now, Dr. Tannen, will you just tell us a little bit about the research that's going on?
Yeah. So the most important is to try and develop new drugs that are effective in the disease. Ideally, you would want a cure for the disease.
Right.
And I think that as a prelude to that, we need to understand what exactly goes wrong in the system that produces the disease, which is what basic science is telling us and doing. So they are doing it from culture systems of motor neurons, from animal models that have been created from the disease, and from studying the human disease as well. So what exactly goes awry that produces the disease?
Right.
So that's one. So we are not involved in that aspect, but we are collaborating with a lot of physicians at different institutions in Boston, New York, Chicago, etc., to help identify that. The second is then to identify treatments that might be effective in the disease, to supplement the effect of the only one medication, approved medication that I mentioned earlier on. And there's a scientific group at a consortium of researchers called the Northeast ALS Consortium, which is out of the Mass General Hospital in Boston, that I used to be a member of in a scientific group. Then you have to rotate off every few years, so I rotated off there. But the idea is that the consortium, on the one hand, works with basic scientists, and on the other hand, with clinicians who care for patients with ALS, and also with pharmaceutical industry and biopharma, to identify and develop new drugs.
Wow.
And then do appropriate clinical trials to identify drugs that might be effective. So that's going on aggressively. There are many research areas going on in the nutritional aspects I mentioned of the disease, to how can we identify and optimize nutritional care in the disease. There are areas of research in the respiratory care, because patients with ALS have respiratory difficulties. So how can we optimize supporting their breathing mechanism in the disease? There are areas of research going on in stem cells, and that's a hot area.
Sure.
Of how can we use stem cells in ALS to see if there might be any benefit from stem cell therapy in people with ALS. And there are 2 studies going on with that already. So there are many different areas of research going on.
And I imagine that the latest ice bucket challenge has been incredibly helpful. That's been amazing, hasn't it, Lisa?
Absolutely. People who have never heard of the disease now know what it is, and nationally we've raised $115 million.
Oh my goodness, that's amazing. So that certainly will have a huge, huge impact on the research being done. Absolutely. And also the care. Now, the ALS Association is not just using those donations for research, are they? They're also using it for the families and for the patients and the families, and resources for them.
Yes, we have care services, which I'm a part of. We have advocacy in Washington, D.C., and of course research and education. And
we also, I know you also have the package of information, the books and the tapes.
Yes.
That go out, and I because I know our family benefited from that. Alan and all of us benefited from that. And Dr. Tandon, you were on those tapes, and that was very impressive, and it made us feel really good that you were one of our Vermont people who were so involved in ALS. And I want to say something to you, and then I'd like you to address it a little bit, but your video at Fletcher Allen, when you have a little video that is on the Fletcher Allen site, and what you say there is that you listen to your patients. And that, I think, is huge. Could you speak about that just a little bit?
Yeah, I think that in the end, we are serving the patient, and we need to be able to help the patient, and the patient help us. So it's a two-way street, really. Right. And unless we know what is the problem that the patient is experiencing, it's not very easy for us to be able to help them, you know. So, and that's what I mean when I say that. So I think that listen to the patient's symptoms, clarify the symptoms if there's some ambiguity in the symptoms and you're not clear on the symptoms. And then see what the patient desires, what they want, because we frequently, and Lisa can maybe speak to this too, we frequently encounter situations in ALS being a progressive neurodegenerative disease for which there is no cure to date. No cure doesn't mean no treatment. There's a lot of treatment available. And I involve the patients in the treatments that I suggest to them. So treatments to control the symptoms, treatment to control their nutritional state, treatment to help them with their breathing, etc. So it helps to establish that relationship with the patient and the family, and then create a dialogue that allows you to do that efficiently.
Yeah. And I think letting them know that and listening is so huge. And for some of them it's so difficult to get their point across. And that was something at the Veterans Home that was so wonderful, was that everyone listened. Yep. Everyone cared. And Lisa, you are such an expert at that. And that was so impressive to me when I heard you say that, because I think that makes the patient and the family feel more comfortable, you know, and know that they can share. This has been really amazing. Thank you so much for being here. I appreciate you coming all the way down to share with us. And Lisa, you too. Thank you for all you do. Thank you. And Al, thank you for all that's going on at the Veterans Home, because it's a gift to all of us in the community. This is part one of our show. In a little bit, we're going to show you what it's like living with ALS. So stay tuned. We've talked about ALS, the disease, and we've talked about the ALS Association of Northern New England. But my guest here now are people who are living with ALS. I'd like to welcome Marty Kasselbaum. Hi, Marty.
Hi,
Thank you
Sally.
so much for being here.
Pleasure to be here.
Thank you. And his wife, Sandy. Sandy, it's so good to have you here. And they're very dear friends, Marilee and Frank Lewis.
Thank you for having us.
Thank you for coming.
Thank you.
Now, Marty, I know you told me that you were going to try and behave today. I hope you don't behave too much. I want you to be you.
Okay.
So
Yeah.
could you tell us a little bit about yourself?
Well, I was a general internist in New Jersey, and we came up to Vermont skiing on weekends, as a lot of people do. And then when I retired and Sandy retired, we moved up here full-time 7 years ago.
Okay.
And we've had a long, successful, loving marriage of 55 years.
Oh, wow.
Yeah.
That's wonderful.
And we have 4 children, 1 boy, 3 girls.
Wow.
And we've had a wonderful life.
Now, are they spread all over the country?
They're
or
all
are
over
they-
the country. And when they spread all over the country, I said to Sandy, it's time for us to leave home. And we came to Vermont.
And you have a wonderful spot.
So thank you.
Beautiful,
It
beautiful
was a
spot.
pleasure having you there.
Yeah, I enjoyed
Yeah.
being there. I really did.
So,
So how long were you in practice?
I was in practice for 32 years.
Wow.
Yeah.
And I know you are very devoted, doctor, because Sandy was saying how you'd come up here and if it snowed, you said, I have to get home to my patients.
Yeah, well, those were the days when there was a very strong personal contact
Yeah.
between patients and doctors did practically everything
Oh,
because there wasn't the subspecialties that we have now.
I think we were in
So,
medicine about the same time when I was
yes,
a nurse.
you mentioned that.
So I know what you're
Yeah.
talking about. It was a different time.
So there's a very close connection.
Yeah. I think I would have liked to have had you as my doctor.
I think you would have.
Yeah.
I do.
All of us.
Sandy, can you tell us a little bit about you?
Well, let's see. I went to Boston University. We got married right after graduation, so we've been married a long time. As Marty mentioned, we have 4 children. We have 10 grandchildren. We have a very supportive, wonderful family. We're really blessed.
That's wonderful. Now, what did you do after? I mean, what did you
I was
major
a
in?
real estate agent.
You
for
were?
the last 22 years.
I bet you were great.
I loved it. I had a lot
Yeah.
of fun doing it.
I'll bet. That was really, really neat. Now, Marty, tell us about, when did you first find out about your diagnosis of ALS?
Well, looking back, I think I was more or less a typical case because for a couple of months, I couldn't get my belt around to the left. And I said to Cindy, I don't know what's going on, but I can't get my belt around. So she used to bring the belt around. But I didn't have any pain or anything else. And this went on, didn't notice it. And then once we were having company, and she gave me a jar to put on a shelf in the pantry, and I couldn't get it to the top shelf.
Now, was this your left
Left
side?
arm.
Left arm, okay.
And which is a usual presentation for one arm
Is that
or
right?
one leg. And I reached up, I couldn't get it up. So I said, gee, my left arm's weak. There's no pain, there's no nothing. So I thought I had a cervical disc or a rotator cuff or something like that.
Yeah.
So again, I think this is like a usual course. And to make a diagnosis, so I went to an orthopedist, did cervical spine x-rays, did MRI of my shoulder, everything was clear. And we decided this is not orthopedics.
Right.
And I went to a neurologist in Pittsfield, Massachusetts, and he examined me and said, I don't know what's going on, but you need an EMG. That's a muscle test. And he told me to come back the next day, and the EMG was diagnostic of ALS.
Wow. Did you have any inkling, as a physician, did you have any thought of this in your wildest dreams? Did you ever think that this was
Absolutely
a
none.
possibility?
None.
None at
As
all.
I said,
The
I was,
farthest thing from your
I was
mind.
thinking of cervical disc.
Right, yeah.
Yeah.
Which is
Because it
logical.
was so limited
Sure,
to the left arm.
right.
But the EMG, electromyography, really is a diagnostic tool. And
Now, did he tell you right then when you had that test? So did they let you know at that point that that was what they expected, they thought?
Yeah, he told me immediately.
Yeah.
Now, being a physician, other physicians are upfront, upright. They know they can't fool around.
Yeah. And this is the kind of thing you really can't fool around with. I mean, you really, it must have been, I mean, I can't imagine, you know, when this is in your face, you know, I just can't imagine. Sandy, tell us now, could you tell us now, right after you received the diagnosis?
We were driving home in the car. What a shock. And we were thinking about it and talking about it. And I guess the first question that came into our mind was, what do we tell everybody?
Yeah.
And we were talking about it. Do you say, you know, you have a neurological disease, or are you really very specific? What do you say? And we had called each of our 4 children on the phone, and we were talking to them, and I was telling one of my daughters our dilemma. And she said, Mom, I have a question for you. Do you need your friends' support? I said, of course. She said, well, how will they know to support you if you don't tell them what's going on? I said, oh my God, that makes so much sense.
And you know, we're so, it's kind of a natural thing to want to keep it to yourself and not to bother anybody and not to impose on them.
Well, we got home, and it's a shock.
Of course.
To come up
I mean,
with such a disease, and especially since I was in the field, there was no fooling around.
Yeah.
I knew the progression, and I think for a couple of days, we have a house, and in the basement is our den, and for a couple of days, we'd go down to the den, and Sandy would come down, and we had some emotional times.
Sure.
And did that for a couple of days, and hanging around, hunkering around, not wanting to talk to anybody, trying to resolve things between us and our children. And I think it was about the 3rd day. I remember it was on a Saturday, and I was sitting downstairs in the den, and I said, you know, I've had enough of this, sitting down here, all alone, Sandy coming down. I've had enough of this. So I went to my desk, and I got out a pad, and I wrote down the name and the phone number of all my friends.
Really?
That's what I did. I still have the card.
Well, you showed it to me. And that's a long list.
Yes. And I wrote down the name and phone number, and I said, tomorrow morning, Sunday morning, I'm going to get up and start calling my friends and telling them the whole story. What I have, what I'm going to go through, and I wanted them to be included. And that's what I did. It took a few hours. Not only my friends here, but my friends in New Jersey. And so I forget who it was, but one of the friends said, well, what can I do? And I said, let's go to lunch. And that was
I love that. I love that.
So that's what happened.
Now, Sandy, you were saying when we were talking that there was something else you wanted to share about.
I had remembered an article I'd read in Ann Landers once, and the article was, if you have friends who say to you, what can I do? Tell them, because they're going to do something, and they might as well do what you need. It would be sad if they spent a lot of energy trying to dream up something, and then it was something, you know, that really didn't work for you. So that's what we do. If people say, how can I help, or what can we do to help?
And you know, that's such a wonderful, and that's so wonderful to share with all of us, because I think we all want to sort of protect our friends, or we just are very private and we don't want to share everything. But it's important, isn't it? Because where would we be without our friends?
You're so right.
You know, it's just it's such an important.
We're just so blessed. We have the most wonderful friends. They are just there for us all the time, and they let us know it all the time. I think we're just so lucky.
And that is so amazing. Now, I want to talk more about the friends and how Frank and Marilee have been involved with that. But Marty, how has this been progressing for you?
Well, it's a progressive neurological disease. I mean, it keeps going,
Yeah.
doesn't stop.
Right.
So my left arm started and it's paralyzed. I can move my fingers, but that's it. And sure enough, someone I remember said to me, "You're righty, it's lucky it's not your right arm." And I said, to myself, you don't know what's going to be. And then my right arm became affected, and now it's like my left arm. And the neck, I have a brace. I brought it here. I don't need it right now, but most of the times I do have a neck brace because my neck muscles are weak. And I have a breathing machine because the muscles in your chest get weakened. But the machine's terrific because when it's on.
And do you use that as you need it, or do you use it at night, or what is
I'm
the
using
routine
it.
with
What happens is you use it more and more. But when you use it, it does what the muscles do, so you feel normal.
So it takes over for what,
So
what
that's
you
the
need.
progression.
Yeah.
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 Each person, of course, with this condition progresses, differently.
Yeah, it's a different. I know from what's my brother-in-law. There's a different.
You
each
have to
case
see
is
how
different.
it evolves.
Yeah,
Some are
exactly.
quicker than others. But getting back to
Now I want to hear about your friends.
the friends, the point of being with friends is just not to be nice and pat your hand. It's have fun.
Yes.
Laugh and enjoy life. And that's what we try to do.
I'm sure. Now,
And
Frank,
they are terrific. And as time went on, of course, now I can't feed myself. And I was at a dinner party when it was progressing, and I was trying to feed myself, and the fork is slipping and whatever. The woman sitting next to me said, "Okay, I've had enough. Give me that fork." And that was, it's tough to relinquish your independence.
every little
You
thing
know?
is
And,
a big deal. I'm sure. I know.
And so she took the fork, and that's when I said to myself, what am I doing? What am I doing? What am I fighting? And that's when I stopped.
But you need to hold on to as much as you can for as long as you can.
So since then, my friends fight over who's feeding me, who's sitting next to me.
And I understand there's a group of you who get together. Let's hear about that,
First
Frank.
of all, we're honored to be here today, and we represent so many couples that Marty and Sandy have befriended, and so thank you for having us. This couple is truly remarkable, and it seems trite to say it, but the fact is that and so many thoughts are going through our heads, but when Marty said he spent 2 days downstairs, and then he decided to make a list up, and he was going to call and share, and that's the kind of guy he is. And I think, as you get older, the people that you associate with are starting to experience some illnesses, and some handle it so differently than others. But Marty and Sandy, and Marty is handling this thing so remarkably that it is lifting all of us up to a point that we never would have ever thought we could get to.
So what do you do?
What we do is, you mean what do we do with Marty?
Well, yeah. What do you do with Marty?
We do anything that Marty's willing to do, which is basically everything. And
He's quite a guy.
I just can't imagine, you try to put yourself in that position and wonder how you would be given any kind of circumstance. And I guess until you're there, you don't know. But one thing's for sure, that Marty and Sandy are setting a standard for all of us that should we be somewhere, we're going to think about you, Marty, and both of you,
Absolutely.
and realize that, you can still enjoy life and fight it off.
Make the most of
Make
it.
the
Now,
most of it.
what do you guys do?
So what we do is every Wednesday we go to Bob's Diner. And
Right here in Manchester.
Yeah, and even those who did not want to go to Bob's Diner go to Bob's Diner, and we've come to Bob has
Because
come
Marty's there.
because Marty's there, and Bob has gotten to know us. And Wednesday they set a special table up for us, and there are usually 8 to 12 guys there, and we just enjoy each other's company and enjoy being with Marty, and
And I think you mentioned to me that everyone kind of vies to be the one who's going to be beating him.
Right? Who's going to sit next to him?
Who's going to sit next to
Yeah,
Marty?
Yeah.
Yeah.
But we've learned that even if you're sitting across, you can still
benefit from it.
You can still participate. And,
Also, they take me to the bathroom, and the first time they took me to the bathroom, I didn't feel awkward because I'm used to dealing with people and this and that as a doctor. So first time, this one guy took me to the bathroom, and he was standing next to me as I was going. I said, "We better hurry up." And he said, "Why?" I said, "Because someone's going to call the police."
You know, you have such an amazing sense of humor. And that's what
that broke the ice, you know.
Sure.
Yeah.
And again, this is one more thing that you've had to deal with, you know, which is another piece of letting go, which is really, really, I know.
And
it's
what's
not easy.
amazing about Marty is that he makes everybody feel comfortable. And you know, there are always those, it's human nature, some are not comfortable with
Well,
disease.
if they don't
and
know about it or they've never seen it, and some people just
can't handle it. But almost to a fault, Marty has made everybody feel very comfortable and has broken down that barrier. And that's one of the great things you've done.
Marilee, how do you see this impacting?
Well, I just want to say then to the point that what we're all making, the men decided that they really love going on Wednesdays to Bob's Diner, and he did not know about this, but they ordered 20 T-shirts, and they put Team Marty on that. And one Wednesday, a few weeks ago, they came and pictures were taken, and it was great. At the same exact time, Sandy didn't know that we saw a couple of us invited her for lunch that day. And when she came in, it was all of us. So we were celebrating her terrific part in all of this. And it was a great day. I have to say it was a great day.
I'm sure
it was absolutely wonderful. It's the women, the men, everybody rallies around them, and they rally back.
And you know, people want to. People are
Absolutely.
wonderful, and people are caring, but sometimes they don't know how to be. So for
You're
you
so
to
right,
welcome
Sally.
them in and show them is such a good. Now, how have you seen a difference? I mean, I know you both well, and I love you both, and you're both wonderful. And Frank has always been a very caring individual, just a really, really neat guy. But have you seen, what impact have you seen this have on Frank or some of the other men?
I cannot get over how much they want to be there, how much they're rallying, how much they love these two people. I cannot get over it. I mean, we all knew, we all had feelings, we all love each other, but when the chips are down, you don't know what's going to happen.
You know, and it's giving them permission to care, to help, just to be, you know, to be vulnerable, really,
Well, actually,
because it is.
The main thing is that we enjoy each other.
Yeah,
And have
that's
fun
true.
with each other.
We do.
Add to the life of each other, the richness. That's the purpose. Just to sit there and make nice isn't enough.
And it does
That
go
goes-
beyond. It does go beyond the caring part. We do, as you just said, we watch football together. We share in the things that Marty enjoys doing, regardless of the disease, and bypass it for those moments and just enjoy.
Yeah.
Oh, it
In
just-
fact, I was going to say, it's interesting, Marty, when you discussed the 3 days that you sat in that den. Well, now the den on Sundays is full of men downstairs.
And now it's football season.
And it really, it's amazing. And they come, and then Sandy somehow gets together a dinner or whatever. She's remarkable
Amazing.
beyond
Yeah.
belief.
Consummate
Really,
hostess.
it's really
I'd like to get
wonderful.
back from a patient's point of view. How really difficult it is to slowly lose your function and your independence.
I know.
It isn't fun.
Yeah.
It isn't fun. And each time something comes along, it throws you back.
Yeah.
And you really have to firm up. And what I was thinking of as you was talking, I was driving, and of course my right arm was good. My left arm was getting weak,
Yeah.
but it was still I was still able to use the wheel and drive. And I drove one day, I drove up from my house and I started to make the turn to get on the road, and I couldn't do it. I had to take both hands to turn the wheel.
Yeah.
And I stopped the car and I said, this is ridiculous. I'm going to get hurt. Someone's going to get hurt. So I turned the car around, came in, drove it into the garage, parked it, walked into the house, and said to Sandy, that's it.
Yeah. And
And then we went to Bennington. I gave up my license. And that's tough.
oh, it is. Every little step, I know.
And so with the feeding, with the driving, one after the other,
the breathing.
the breathing, the neck brace.
Yeah.
We went out to lunch once. My neck was hurting so much because it bent forward that I went to a brace clinic, got a brace. Each step, more and more and more limits.
And that, I think, I did see this with my brother-in-law, that, you know, that giving up, and it's so hard for you to see, you know, to see the struggle of letting go of another piece of
But
yourself.
you have to readjust
Yeah,
and
it's
say,
very,
you
very
know,
difficult.
so that's gone. Driving
Right,
isn't my life.
right.
And as long as somebody feeds me, I'm nourished. And that's how you
You have
look at
such
it,
an incredible
you know?
outlook.
that's
You
it.
really do. I mean, and I think you're such an inspiration to all of us and to all of you out there, you know, to hear you say this. Now, there is, I know that you were involved with Lisa Anderson from the ALS Association. Now, there's another organization that you've been working with that's been very helpful. Could you share that with us?
The organization is called Compassionate Care ALS. They're located in West Falmouth, Massachusetts, and they come all the way here to Vermont. They've spent a lot of time with us. They told us that they were here to help us in any way that they could. They're an unusual organization. They're not fundraising for research, but to really make concrete difference in the life
In
of
the
an
lives.
ALS patient.
And the families.
I'm sorry?
And their families.
Yes.
Yeah.
And so they ascertained that Marty could be helped very much by a lift chair, which is kind of like a lounge chair. But when it comes
it
up,
lifts them up.
it puts you into a standing position. And they brought that over. They brought over just a lot of things like that have really, really
And you
made
said bathroom things they were helpful with?
to help with the shower and the bath and all kinds of really wonderful things that have really made such a difference to make Marty's life easier. They are so caring, so wonderful. They also brought an electric stair lift to get to our bedroom on the second floor. They just
And they
have
seem
been
to
so-
know what you need.
Yeah.
they just
You know,
somehow
they
can
feel.
You said that the
understand
gentleman who started this organization,
Yeah, was an ALS patient himself, and the gentleman who took care of him is now the head of Compassionate Care ALS. His name is Ron.
Yeah.
And they've just
And-
been so good to us. They've really made such a difference in Marty's everyday life.
and that's so important to know that there is help out there, that there are things available, and I think that's we'll put all that information on the screen, so you at home, if you want that information, you can have it and contact them. And how are your children with this? How did your children?
I think it's very hard for them because they live so far away. They're all over the country. They try to come here as often as they can, but they call every single day. They are so wonderful and supportive. They're on the internet all the time, looking up all kinds of, whatever is new in the ALS world.
I bet you get bombarded with things.
They're wonderful. They're just really, really wonderful.
This is just an aside, but my son came with us to meet the second neurologist, and he's a doctor also, and he's a very straight guy. He wants the facts, and that's it. So we went out to dinner after an extensive examination. And I'm taking these pills for cholesterol. So Art says to me, well, I guess you won't be needing them anymore now that you have this serious condition. I said, Art, while I'm having to live through this serious condition, I don't want to die of a heart attack.
I love it. I love it. That's absolutely wonderful.
You know, that's one of the things that, for me, is so wonderful, because Marty is so upbeat. He sees the positive side in everything. And as a spouse, I have to say that makes it so easy for me to be there for him.
Well, easier.
Well, she is there for me.
Easier.
Too much. I keep asking her, it's too much for you. And she says, no, it's fine. I can't believe it. Upbeat from her point of view.
Yeah.
And nothing is too much to do.
Well, you are. You are just a. You are in. You know, as a couple, I am so thrilled to know you.
Oh, we are
both.
thrilled to
And
know you.
you're
Yes,
friends.
you're a lot of fun.
And I just,
Yes.
you know, I can't say enough about what an inspiration you are to all of us.
Absolutely.
And to everyone out there. I mean, to see how you have been dealt this hand and you're dealing with it. You know, you are living with it, but you have such a beautiful relationship. I mean, you're an example to every couple, not even a couple that's going through something, but every one of us as a couple.
We're so blessed
You
to
know?
have each other.
Well, we are
really
blessed
are.
to know you, and I, as I say, I'm looking at this clock and I'm saying, okay, we're winding down. So let's. Could everyone just? I'll start with you, Marilee. Do you have any final thing that you'd like to share?
I don't think in my lifetime I will find two people like this who are not only devoted to each other but devoted to everybody. They are unbelievable what they've done for the community before and after your diagnosis. It truly is a delight. You're a delightful couple.
Thank
Frank,
you.
how about you?
I think that we're all thinking that, you know, if, God forbid, we should be afflicted with something, that watching these two, watching Marty work through what is a devastating illness, will hopefully guide us, if something should arise, to be able to not belabor the point, but to get up and above it and go on
Make
with
the
your
most
life
out
and
of each day.
make the most out of each day. So.
Sandy, would you like to, any final words that you'd like to share?
No, I guess I just want to repeat how lucky I am to have Marty as my husband. And
That's too sweet.
we just work really hard to enjoy our life and to enjoy each other, and it's good. Life is good.
Yeah, you're wonderful. And Marty,
Yeah.
any final words from you?
Well, you hear the general statement, you only have one life. You better make use of it. And there's only today. Today's gone. It's gone. So you better make use of today. And everybody passes that off as just a statement, but it's true. It's true. You only have one life. There's no second. And you better make use of it with what you have every day.
Well, you have been, I just love you both. And of course I love you guys. And all of you out there, hasn't this been amazing? You know, here we are talking about this, as my brother-in-law called it, the mean disease. Because it is a mean disease. It robs you of a little bit at a time, or a little faster at a time, whatever. But life is a present. And every day is a present. And you two are such an example. You are just an example to all of us, an inspiration. And you give us all hope that no matter what is going on, you can look at the best side of it, the bright side of it. And I thank you from the bottom of my heart to both of you.
Thank you
And also, thank
for
you
having us.
and for all of
you
you
for
out
having
there,
us.
we hope that you found all of this information helpful. We will have the information for the ALS Association and the organization that Sandy was talking about. And be good to each other and keep talking. Till next time, bye-bye.